Itchy scalps are one of the most common reasons that patients come in seeking care after having sought out so many over-the-counter remedies trying to control this symptom. The biggest challenge that they face is trying to understand why their scalps are itching in the first place so that they can get a better handle over how to approach it in the future. When it comes to itchy scalps, there are a number of triggers that can set off this symptom, and understanding how each looks and how it feels can help us navigate what you might be dealing with and how best to approach it. One of the most frustrating aspects of itchy scalps is sometimes you may look at your scalp and not actually see any changes. No redness, no scaling, no irritation. Sometimes people might come across or stumble across scabs or crusted areas, but it doesn't always give them a hint of what could be triggering it. Evaluating our patients for itchy scalps really is broken down by history in terms of what types of symptoms they experience, when they experience them, what makes it better, what makes it worse, what could have set it off in the first place, as well as a very close examination of the scalp to identify if there's any primary skin lesions or changes in the skin that could suggest a cause. The range of triggers for itchy scalps is from dermatologic conditions, meaning you might actually have actual skin lesions that might be itching or irritated. There might actually be changes in the scalp as a result of the natural microbials that live on our scalps. Our scalp has its own unique bioflora. There are 3 microorganisms that dominate in our scalp, the first being Malassezia, Propionibacterium, now known as Cutibacterium acnes, as well as Staphylococcus. Sometimes when their natural balance is impacted, this could trigger inflammation, which might need to be addressed so that we can restore that natural balance and try to reduce some of those symptoms that you might be experiencing. There are 4 other triggers for itching in the scalp that are worthy of reviewing, because sometimes people don't always put these in their list, and it's better to understand what possible triggers might be there. The first would be neuropathic triggers for itching in the scalp, which would be, quite frankly, just originating in your nerve endings. Some of the more common triggers for this would be shingles, as well as trauma to the scalp or to the nerve endings feeding into the scalp, as well as notalgia, which is inflammation of the nerves that travel to the scalp, sometimes originating from inflammation around the spinal cord. The next trigger for scalp pruritus could be neurogenic, which means there can actually be symptoms related to systemic diseases that trigger inflammation in the nerve endings feeding the scalp. The 2 more common triggers for this would be chronic kidney disease, as well as cholestasis. There can be psychogenic triggers for itching in the scalp related to stress, anxiety, depression, and a variety of other psychosocial factors. And one of the triggers we don't always talk about that's worthy of discussing is that I have a tremendous number of patients that are over the age of 80 that often will complain of itching in their scalp, and some of this is likely related to changes in the structure of our skin in the scalp. Our scalp generally has a thicker quality throughout our lives, but as we get older, our skin does naturally thin. Our skin is also responsible for thermoregulation. As we get older, as our skin thins, that thermoregulatory property could be impacted, and some people may manifest this as itching of their scalp. That can be strongly triggered by environmental factors, whether it be lack of humidity in the air, dryness. These can all trigger inflammation, dryness that can lead into itching and be very frustrating in spite of a variety of interventions we might take. The most common trigger for itching of the scalp is a condition known as seborrheic dermatitis. This type of inflammation in the scalp is related to that delicate balance of a species in the scalp called Malassezia and its interplay between sebum, lipids in our skin, and our immune system. When that balance is thrown off, it can trigger inflammation that leads to itching, sometimes flaking, dryness, and scabbing, crusting, and other types of manifestations that can be very frustrating and often triggered by stress, changes in season, changes in climate, or some hair products we might be using, or just changes in the products that we're using. Not that you're actually allergic to products or what have you. It might just be that you've tried some new products that your skin has to somewhat adapt to. There are a variety of autoimmune conditions that can trigger itching in the scalp, which are important to evaluate for only because some of them can be linked to loss of hair, and sometimes that hair loss can be irreversible. It can lead to scarring hair loss. It's absolutely essential that this is evaluated, only because early intervention is key so that we can salvage as many hairs as possible and reduce the tendency of this to progress, just so that you don't have any scarring, alopecias, or hair loss associated with scarring that can be harder to restore over time. The next most common trigger that I tend to come across when it comes to itchy scalps, and this does have to do with actually asking the right questions of our patients to get a better understanding of what could be an actual trigger, is what we refer to as neuropathic conditions. This is when there's inflammation of the nerve endings leading into the scalp as a result of a variety of triggers. Sometimes there can be postherpetic neuralgia, there can be shingles itself triggering some of that inflammation. I've had patients that have scalp itching as a form of a symptom as an aura for a migraine. I've also had patients who've experienced, say, a car accident or spinal cord injury, and they can also manifest itching of their scalp. Sometimes it's postural or positional, where just chronic inflammation around the spinal cord related to our posture can also relate to itching of the scalp. Identifying some triggers based on lifestyle, based on exposures, based on things that have happened to our patients is essential, because some of our traditional interventions may not always work when it comes to these patients. Thus, giving them a medicated shampoo may not actually be the answer. Might alleviate some of the symptoms temporarily, but won't really get through to the actual cause or trigger. And if we can start to identify those triggers, we can usually come up with better remedies or solutions to help navigate the symptoms that can be complicated for our patients. Identifying with our patients what symptom they're actually experiencing is essential, because there are some other triggers to symptoms in the scalp that might be perceived or described as itching by my patients, but it might not be that traditional sense of itching. There is a term that was coined about 10 years ago called trichokinesis, which is basically that sensation of feeling like your scalp is sensitive. That means that when you touch or stroke your scalp, there's this increased sensitivity. It's almost an abnormal sensation but is perceived as really uncomfortable or frustrating for some of our patients. They might describe some tickling or irritation in their scalp as well. We do believe some of these symptoms might be related to small fibers or small nerve fibers that innervate the scalp that lead to this intensity of the symptom. Identifying how that itch or how that symptom is felt, and if there's any pain or sensitivities associated with it, can help us navigate our patients to the right resources to help address the underlying triggers for some of these symptoms, because again, it may not be as simple as just giving a medicated shampoo or topical to address it if it's a deeper trigger or cause for that symptom. Now, it is true that some people just have sensitive scalps, and it's because our scalps are really exposed to everything. Our scalp is exposed to so much. It's exposed to the environment, to pollution, it's exposed to sunlight, hair products, blow dryers, hair curling irons, hair dyes. There's so much that it's exposed to that sometimes there are just some sensitivities that could be related to the products that we're using, or just the repetitive nature of trauma and irritation our scalps can go through. Understanding how some of these things can feed into the symptoms can help us navigate our patients to better scalp management processes, but also recognizing that sometimes the structure of our skin is just changing as we get older. Our scalp, our skin in general, just gets thinner, and I do find that many of my patients will find that this leads to increased sensitivities in the skin. Going to a dermatologist, having your scalp closely evaluated so that we can magnify, look through the skin, make sure there's no obvious sources of inflammation, scaling, roughness, hair loss that we need to address immediately is essential. Then we can start to navigate interventions that might help you through this process. Because a lot of times the skin of the scalp, even though it thins as we get older, is still relatively thicker, and it's hard for products to penetrate through. And sometimes we do have to rely on medications by mouth or injectables to really get that symptom under control. We do have ways to navigate it, even with interventions such as phototherapy, that it is worthy of talking to your dermatologist to navigate your choices and avoid wasting lots of money. This can help reduce the tendency to go from product to product over the counter.